We shall see. So now we'll talk about tick attachment times. A big question for people because of a lot of things that they read out there is, the tick was on 12 hours, 24 hours, 48 hours. Like when does it actually transmit pathogens? And, I get these stories of my patients going to urgent care and they say, well, has the tick been on 48 hours? And they say, well, no, I don't think so. And then, no action is taken. So I think it's really important to first acknowledge if you knew when it attached, you wouldn't have let it attach, right? So if you saw that tick crawling on you before it attached, you would have taken it off. They're pretty small. And if you find one on the back of your knee, you may, who knows how long that's been on if it's not an area of your body that you're looking at very much, right? And people are often surprised when they take that tick off and then they show them and they're like, oh yeah, I think I got it last night. I was out, I went for a hike and I must have gotten it then. And they show me this huge engorged tick that clearly was on at least a few days, because that is one way we can tell regarding how engorged it might be, regarding how long it has been attached. Anyway, we'll move on here to this chart, and you can see the minimum recorded tick attachment time resulting in transmission of pathogens from a tick to a human. So we've got Borrelia. I know it's all the Latin names. So we've got Borrelia burgdorferi. That is the cause of Lyme disease. And 4 hours, there's actually documentation that it only took 4 hours. Now, most studies aren't looking at that short period of time. So most of these transmissions are recorded at 12 hours or 24 hours or after that. So I think we need a little bit more research on this to really pin this down. But interestingly, it just seems like some ticks take longer than others to transmit Borrelia or other pathogens. And so we've got Anaplasma is 12 hours, Babesiosis is 36 hours. And, could it be transmitted sooner? Was it researched at 4 hours or 12 hours? These are all really important questions to look at. And then later, these tick-borne relapsing fever pathogens, Borrelia hermsii, mayani, is the other cause of Lyme disease. I was going to say hermsii, turicate, those are both 15 seconds, right? So very, very quick. So those are attaching at night, for people who might be inadvertently the hosts. And then Powassan, also really important, 15 minutes. So, of course, Powassan virus is rare, thank goodness, because it can be fatal. It's very rare in ticks, but it is transmitted very quickly if it is carried by a tick. Yeah, so you can take a look at this chart. There's some we don't know how long they take to transmit, and I think this is really important information. So, with this information, just to say, we want to prevent these tick bites in the first place, right? Because some of them are 15 minutes and 15 seconds. Second is to say, don't go by time. I don't really go by time if somebody says, oh, I could not possibly have this on for more than 4 hours, unless it was, right on their arm, somewhere they're looking at all the time, right? If it's somewhere on your body, you just really may not have noticed. And there are so many ways that we can get these tick bites. So also to think about, to make it more complicated, is that partially fed ticks actually have a shorter transmission time on a second host. So if you have a tick that attached to, say your dog or an animal or something, and that feeding was interrupted, they fell off, and then they found you, they're sort of primed. So it doesn't take as long for this tick to transmit the pathogens. And 10% of those ticks out there actually have already had a partial blood meal, which means they are primed to do that. And for these classification of ticks out there, within 24 hours, 83 to 100% of those partially fed nymph ticks will transmit Borrelia burgdorferi. And within 48 hours, 100% of them will. So this is really important information to say, it's quicker for these 10% of ticks. So it may be that somebody had a tick bite from a partially fed tick, and that's also why this whole idea of how long does it take to transmit Lyme gets a little fuzzy. All right, so with that, we'll spend a little time talking about Lyme and tick-borne diseases. So we're going to, see this huge map of diseases out there that cause Lyme and tick-borne disease throughout the whole world. So this is a really detailed chart here. But today we're just going to go through three. We're going to talk about Lyme disease, Anaplasmosis, and Babesiosis. So Lyme disease, as you may know, was discovered in Lyme, Connecticut by Dr. Alan Steer, who was seeing a lot of children with what he thought was juvenile arthritis. And in 1975, it was realized, there's actually an infectious cause to this. Just a little later, in 1982, just across the Sound into Long Island, New York, Willy Burgdorfer discovered the bacteria in these ticks. And of course was named after him, Borrelia burgdorferi. Of course, we know Otzi is this Iceman that was discovered in the last decade or so. And there was Borrelia found in him. So we know that Borrelia, the cause of Lyme disease, this bacteria has been around for over 5,000 years. So getting more into the signs and symptoms and what to look out for after a tick bite regarding whether you might have acquired Lyme, the symptom onset is 3 to 30 days after a tick bite. So I always want people to watch out for symptoms, watch for that rash if it happens, check that site of the bite for 30 days after a tick bite. And just a little bit about the Borrelia burgdorferi bacteria and the ways that it can hide in the body. So this is our shapeshifter. We see that spirochete on the left. So it's a little bit of a interesting way that it exists and moves in the body. And that spiral nature of it, it can really get into certain tissues like the connective tissue, which it loves. But it can change forms and become dormant. So we've got our cyst form, which is also called the round form. And when it's in that form, it's not going to respond to antibiotics, and your immune system is not going to see it. So it's really important to acknowledge that this has repercussions on how we choose treatment and thorough treatment for Lyme disease. And here we have biofilms. So these Borrelia, these bacteria create communities surrounded by this biofilm, and it's a slimy mass of basically proteins and polysaccharides, and it protects the bacteria from the changes in pH and temperature in the host. So this is a way that it protects itself. And again, antibiotics don't get through that biofilm. So we need to use other things in our treatment. In my training and as a naturopathic doctor, I use a lot of herbal medicine. And for instance, serrapeptase breaks through this biofilm. So we'll see that later in our treatment plans. So looking at Lyme reported cases from 2001, you can see in comparison here, now 2022, all the little dots and how we're seeing them in all the other different states and not just in the Northeast, right? So that's the CDC way of surveilling anyway, but it's a little bit about that. And the CDC actually claims that incidence is higher than reported, and I think this is really important. So in 2019, they reported about 35,000 cases, but they admit that this figure only represents 10% of the cases meeting the criteria. So they're saying actually there's probably 350,000 new cases that occurred in 2019. And then we have this other study from 2010 to 18. They were saying actually it looks like 30 to 40,000 cases of Lyme were reported by the CDC. However, health insurance claims data showed that 476,000 patients were diagnosed annually from that period of time. And now, as I had shared earlier, we have the 2022 numbers in, 62,000 new Lyme cases. And this is a 68.5% increase compared to the 2017 to 2019 average. And the incidence, I think it's important to note, is really increased, almost doubled in the population of people over 65 years old. Now, of course, there's also discussion about, well, why is this number so much higher? The CDC actually changed their criteria, which is a good thing. It's more inclusive of what needs to be looked at. And if we apply that idea of the 10%, maybe it's actually 620,000 Lyme cases in the last year. But let's get into the signs and symptoms of Lyme disease so that you know what you need to look for after a tick bite. So here we have our Erythema migrans, the bullseye rash. It's not always perfect like that. This is a great picture. It's great if this happens. I joke with my patients, they might come in, they have a fever, they feel horrible, they missed work, they have this bullseye rash, and they just feel horrendous, right? And I'm like, this is great. We found the bullseye rash. So it's a great signal to say, okay, you have Lyme disease. Let's treat it. We're treating it early. It makes all the difference to treat Lyme early so that you do not have consequences of neurological consequences, other symptoms that can come up and cause trouble long term. So you might have that short term, really just a few days or a week or so of feeling pretty awful. But with treatment, people feel better pretty quickly. So look out for that bullseye rash. However, it happens less than half of the time with people who have been diagnosed with Lyme. Only half or less recall a bullseye rash. So this develops within 30 days after the bite. And really the criteria is that the rash is more than 2 inches in diameter. So what I recommend people do, right after a bite, you might have some local irritation. That's very normal. You had a bite, right? So it might be, half an inch or less around, some redness. That's just because of the bite. This rash is actually a skin infection. So this will happen later. It's not going to happen immediately at the tick bite site unless it's been on a while, I guess I should say. But again, the size, if it's just really local, that's just the bite. But if you're seeing that it spreads outward and it's more than 2 inches in diameter, that is really important. And we'll look at all the ways that it can appear. But what I say is, okay, if it's getting to that 2-inch mark, make a circle, take a pen, draw a circle around it, take a picture, document it, send it to your doctor, hopefully a Lyme literate doctor. And then, if several hours later it changes and it keeps growing, because that's what this rash does. Untreated, it will grow and then it'll just disappear. So it'll get distorted over body parts. So just to keep an eye on that. So here are some different ways that it can appear. So we've got diffuse borders. Then we have this larger lesion on the chest. Hard to see, but if you go outward, you see that border there. And then the blister. And then there's the disseminated rash. Now these look like target lesions, right? But you can have multiple target lesions all over your body. That could be confusing. Most, the other rashes that we're looking at are going to happen right around the tick bite, but then this disseminated rash can be all over the body. Also very important to look out for. And then we have the back of the shoulder. So this is kind of to say, oh yeah, if this was on the back of your shoulder, usually these rashes do not itch or hurt. You may never notice that. And maybe that's why people don't notice, because they're not looking, right? So if you had a tick bite, if you have a known tick bite at least, please keep looking for the 30 days at that area. Use a mirror, ask for help, so that you can check in on that to see if that rash has occurred, because the first sign might be a rash without any other symptoms. So if we could find that and get it treated, that's the best. So then here we have a darker skinned individual, and you can see how different that looks and how hard that is to see on the back of the knee there. That's an Erythema migrans. So Black patients have 5 times the odds of disseminated diseases, for disseminated disease of Lyme disease. So disseminated meaning, they are less likely to see the Erythema migrans, Lyme rash, and more likely to come in with the fever or the Bell's palsy or joint pains, joint swelling as a Black patient. And so that means that they've missed that earlier window to get the treatment. So if you find an Erythema migrans, you're going to have and you treat, there's a better outcome. So just something to be aware of. It's harder to see. So if you have darker skin, please, take the extra time to really try and find that bullseye or that Lyme rash if it's there. And doctors and practitioners out there, please, be aware of this and educate your patients on this. Okay, so signs and symptoms beyond the rash. But just to say, yes, we know we've talked about the rash, but other things, it could be warm to touch, but it doesn't have to be. It could be flat, it could be raised, it could look all these different ways, right? So then also we're looking for flu-like symptoms, fever, chills, sweats, that fatigue, like you have the flu, headache, swollen lymph nodes, especially near the tick bite site. So that could be in the neck, but if it's a knee, a bite down the leg, it could be a knee, it could be the groin, where you have, lymph nodes all over your body. And then joint pain, joint swelling, muscle pain, fatigue, headache. Then we can have heart symptoms. You can have AV block as a cause of Lyme disease. So chest pain, shortness of breath, palpitations. These people need EKGs, and that needs to be diagnosed right away and treated properly. Eye symptoms, you could have itching, burning eyes, redness of the eyes. And the neurological symptoms, acutely, early on, you can have Bell's palsy, which is a facial nerve palsy. Usually it's one-sided, and that's where you lose motor control of your face on one side. So you'll see a drooping eye, you're closing the eye, you won't be able to close the eye, or the mouth. Some people notice this first when they're drinking, and then they're dribbling out the side of their mouth all of a sudden. So that happens acutely. Other neurological symptoms can take some time to develop with Lyme disease, things like tingling and numbness, cognitive changes, personality changes, many different things, as you can see, that one can experience with Lyme disease. And then just a note on pediatrics, I think it's important to share that the highest proportion of new cases of Lyme disease are in 5 to 9-year-old children. So please think about your kids and protecting them. We want them to be outside. Nature is so important for our health. And in the area where most of my patients are, we just have a gorgeous landscape, and you want to get out there and enjoy, right? And I want you to do that. But please, we'll talk about so many preventative options that there are. So please engage with some of these strategies so that you and your kids can be protected. Sometimes with children, Lyme can manifest in different ways, or, of course, depending on how old they are, it's hard for them to communicate or know, like, something's wrong and what is it. So sometimes how we see it manifest is through developmental delays. So if you have a known tick bite, and then after, time is marching on, and, speech or motor coordination, all the different developmental stages, like there's something that's off or that's not happening, that can actually be a sign of Lyme disease. Sensory integration problems, behavioral changes. Sometimes with kids, it's more digestive issues that come. I don't really see that much in adults, but with kids, I do. And of course, they can have some of those other symptoms. And if they have a swollen knee, that is very, very classic for pediatric Lyme. But these are some other symptoms that they might have, or that might clue you into saying there's something wrong, there's something that changed. Let's get this checked out. Let's get a Lyme test. Okay, so we've talked about Lyme disease. That's the big one. Anaplasmosis is the second most common tick-borne disease in the United States. So let's talk about that. These are carried by the black-legged tick. So same tick as what carries Lyme. And this was discovered in 1993. It's a gram-negative bacterium that infects granulocytes, these specific white blood cells. And the onset of symptoms is from 5 to 21 days after a tick bite. So here we have the map. So the darker the purple, then it's, the more cases or higher incidence of anaplasma is seen. So the Northeast and the North Central states are the top areas. And so here are the signs and symptoms. Now, when I see people with anaplasma, often they might call, and I might see them, very quickly, or they might go to urgent care or the ER, because this is high fever. We're talking 104, 105, severe headache, worst headache of your life. They're usually stopped in their tracks. Something's very, very wrong. They're not able to function in their day, and they seek out help. So often you will know if you have anaplasmosis. So if that happens after a tick bite, please get that checked out and mention that you had a tick bite. So other than those symptoms, muscle pain, fatigue, flu-like symptoms, you can have a little bit of nausea, vomiting, or abdominal pain. It's a little more rare. Cough, a little more rare. A rash can happen. This is very uncommon, but it's kind of this splotchy rash around your body. That's not on the face, palms, or soles. But mostly it's the top of the list are the symptoms that I see. And luckily, anaplasma can be easily tested for, diagnosed, and treated. So unlike Lyme, where we have lots to talk about there, anaplasmosis is easily treated with 2 weeks of doxycycline, which is phenomenal. So if you get that diagnosis, which the testing is also very, very good. We'll talk about that with Lyme too. The testing isn't very accurate, unfortunately, with Lyme disease, but it is with anaplasmosis. So there's a lot on your side, even though, again, acutely, you might feel absolutely horrendous. There is an answer, and you will feel better soon. So getting that attended to is quite important. All right, babesiosis. So we've got the third, the third top tick-borne disease. Ehrlichiosis is also out there, which is similar to anaplasmosis. We only have so much time today, so we're not going into every tick-borne disease, but this one's also high on the list. So this is passed through the black-legged tick bite. So first diagnosed in 1966. This is a protozoan or a parasite. So I also think it's important to note, because of that, a lot of the tick-borne diseases are bacteria. So this is treated differently. It infects the red blood cells, and it's very important to note if you have Babesia, because you need to get the right treatment. Some people are actually asymptomatic, and it will resolve on its own. But then it really runs this range of, some people it can be fatal. So the symptom onset can be several days to a few months after a tick bite. And here's our map. So the more orange, are going actually into purple, brown, the higher number of cases of babesiosis. So again, mostly Northeast, but also around the country. And signs and symptoms. So again, fever, acutely, any of these tick-borne diseases will cause fever. Fever, chills, fatigue, headaches. Headaches for Babesia are more like a pressure headache. Muscle pain and joint pain. Joint pain isn't too big in babesiosis. But remember, you could have Lyme and babesiosis transmitted. So these ticks might be carrying multiple pathogens, and they can transmit them. So it might be a mixed picture. And so getting thoroughly tested and treated is really important, especially when we're dealing with a parasite like this that requires different treatment. A classic presentation of Babesia that I see is excessive sweating, especially night sweats in men or women that are not near menopause is very odd, right? Heart palpitations and chest pain, which those can overlap with Lyme symptoms. Air hunger, this very particular description of this difficulty breathing, but it's not on exertion. It could just be sitting or laying down, and people feel like they just don't have enough air. That's how it's explained. And also this kind of cough that can go with that. That's not a productive or upper respiratory issue kind of a cough. All right, so we've made it through ticks and some of the tick-borne diseases, so I hope you feel more equipped on those notes. And now let's get into tick control and tick bite prevention. So understanding the tick habitat can help set us up to understand how to strategize against getting rid of ticks or protecting ourselves. Ticks can be active above 28 degrees Fahrenheit, most active above 45, and with at least 85% humidity. That's their time when it gets to that point. So, you know, we're getting there, and especially on these rainy days, or you know, the humidity in the Northeast in the summer can be quite high. So, and you know, all through the country in different areas. So something to keep aware of these factors. Where do they like to be? They love to be in borders, like where the transition zone is from grass to woods. They like to be around gardens and wood piles, stone walls. If you have debris or a shed and this transition zone around that. They love being under leaf litter, moist areas in the shade. And they need hosts. So thinking about that, so they need small mammals. So if you have a lot of mice or voles or, you know, whatever small animals around, that is going to give them the host they need to get the blood meal. So thinking about reduction of the tick population in the landscape is really applying all that information. So let's rake up the leaves, be careful while you're doing it, please be protected, trim the shrubs, keep the grass short. Keeping it short will not prevent ticks from living there, but it will decrease the humidity and allow the wind to get in there a little more in the sun, so you might have less ticks. Clear your brush and debris from your gardens. You can create wide paths to walk on, or if you're going out, you know, into a hiking path or something, just thinking about, let's not walk through the long grass. Let's choose the path that has stones or just dirt or whatever. You can create some transition zones of cedar chips, you know, around your property between the grass and the woods, if you live in such a place. Remove or move bird feeders to the perimeter, like move them out. Don't keep them close, because those birds can carry the ticks and drop them off in your yard. Move the garden or place it from the perimeter, so you're not out in the areas that they are. And then thinking about deer, using deer fencing or using plants to repel deer, and then using tick tubes, which we'll talk more about. So here's a little picture about all this, just thinking about a typical sort of suburban place which you may or may not live in. And then we have host management. So thinking about our white-tailed deer. So, you know, deer are talked about a lot regarding Lyme disease. And it's interesting. It's interesting because they actually don't carry Borrelia burgdorferi. And so even though they don't carry it, what happens is they will sustain the nymphs and provide a blood meal for the adult females who need the blood meal to then lay those eggs. So 90% of adult Ixodes scapularis, which is our black-legged deer tick, feed on deer. That's a lot, right? So they're an integral part of the tick life cycle, is basically the issue there. So deer reduction is talked a lot about. You know, it's been interesting. Like, it was very, very successful on this island in Maine to eliminate deer and have an impact on ticks. in a great way for us, not to have ticks there. But it doesn't always pan out that way. So it's an interesting topic. And something that's been used, that's been researched and pretty successful, something to consider, although there's a little cost to it, is this 4-poster tick control deer feeder device. So, it has been looked at that it has decreased the black-legged population by 50% in the 3rd year, 60-something% in the 4th year, and 70% in the 6th year of use. So this is kind of like a long-term commitment. We see that it's more effective over time as you utilize this. And what it is it's an area where deer can come to get bait, and while they're there feeding, there are these vertical poles that have permethrin rollers on them, and so they get that permethrin on them, which treats the deer's head to kill ticks. So permethrin we're going to talk about, and it is a chemical used. We can use it in a lot of different ways, and there's a lot of conversation about the safety of that. But it seems pretty good for this, this idea of decreasing ticks on deer, which therefore can have the impact of killing adults before they lay those eggs, right? So that we have a whole new generation we're going to prevent of ticks. So just a word on permethrin. So this is a pyrethrum, which is a constituent in chrysanthemum flower. And it has been used for over 2,000 years to repel arachnids like ticks and insects. Permethrin, though, is synthetic, right? So it is potentized and changed to a certain degree where it has more effect. So now it's an acaricide, an arachnid killer, created in 1973. So this permethrin, this chemical, will paralyze ticks by changing the nerve function through the nerve membrane sodium channels. So what's important for us is to remember that it's toxic when it's wet. So we'll talk about different applications of this. So if you're using it to spray your shoes and socks down, you're going to want to wear gloves to do that. It is safe for humans and pets once it's dried onto the material, but it will still repel ticks. However, environmentally, it is highly toxic to freshwater and aquatic organisms, honeybees, and other beneficial insects. So when we're thinking of spraying it on the environment, that's a different story. Low toxicity to birds, at least, but yeah, it's definitely a big topic of discussion. All right, we also have another host, the white-footed mouse. So let's talk about them. So 75 to 95% of the larvae, that first stage, that little itty-bitty Ixodes scapularis black-legged tick, becomes infected because it fed on this mouse, right? So when ticks are born, well, there's Borrelia miyamotoi that can actually be transmitted, which is pretty rare. We don't see a lot of it, but that's true. But Borrelia burgdorferi and other pathogens are not transmitted in that way from mother to child, so to speak. So the tick needs to become infected by taking a blood meal on an animal. So usually, like we talked about, they're going to go for a small animal like a mouse, and it's where they get infected. And then after that, they're nymphs and then adults, and those are the ticks that really go after humans. So then they can transmit the Lyme or whatever pathogen they got from the mouse to the human later on. So this is a really important concept because we could actually think about interrupting that process, right? We want to target the mice or specifically the ticks that are attaching to the mice, right? So tick tubes are really a wonderful invention. So I recommend this all the time. I've used them myself, and every year I get feedback from my patients saying, wow, yeah, it really made a difference in our yard. So you can do it yourself. You can I have a video out there with Project Lyme, which is an awesome organization. If you want to find it, it's on my website. If you want to find some instructions regarding how to make your own tick tubes, but you can also buy them. And so the idea is that we're going to treat some cotton balls, or you can save dryer lint, and anything you think a mouse might like to bring to its nest, right? So you treat that with permethrin and then let it dry. Wear gloves when you're doing it, protect yourself, right? Then stuff those tubes, so you can save paper towel tubes or toilet tissue tubes. I have people that actually just make PVC tubes that they reuse year to year. So that's great too, whatever you want to do. And so you stuff that material in there, and then you put them out into tick habitat, which is mice habitat, mouse habitat, same thing, because the mice will go and bring that material back to their nests, and then it will kill the ticks on them and their family members, and is incredibly effective. So there's a little picture giving those mice some nice material for a soft bed. And so we have some research. So over an 8-year period, there was a 93.6 reduction in exposure to ticks on humans as a result of using these tick tubes in New York. So incredible. And that's what I hear all the time. It really makes a big difference. And I would put them out. I would put them out 3 times a year. I mean, depending on where you're located, right? Say in the Northeast, I'm thinking now, depending on where you are and if there's still snow or not. April, May is a good time to do it. And then, midsummer, and then like maybe October, right? Because those adults are going to be coming out in October. So that would be a good schedule. All right, so let's talk about treating the landscape. So we have our lovely yard with our mouse and our deer. So first to just talk about, what's the industry standard, right? And for better or worse, what's the most effective? Treating the landscape is using something that's a pyrethrum called bifenthrin, which is the most commonly used, but there are many options. So this is a synthetic pyrethroid as well, like permethrin, that paralyzes ticks and therefore kills them. And now we're talking about treating the landscape with this. Then what are the consequences? Yes, it's highly toxic to freshwater aquatic organisms, honeybees, insects, toxic to birds to some extent. So there are alternatives as well. And there's a lot of research, more and more, and it's great. Every few years when I really look into it, it's like, okay, maybe we're getting closer. So hopefully we can find a really great way. And usually I'm just thinking about, doing multiple things. Like if you've got your tick tubes, they're working great, but maybe we need to, think about, do we want to use some essential oils on the landscape as well?